Describe your experience in assisting with various ophthalmic procedures.
In my previous role at City Hospital, I gained extensive experience assisting with a wide range of ophthalmic procedures. I worked closely with ophthalmologists in both the clinic and operating room settings, which provided me with a well-rounded understanding of preoperative, intraoperative, and postoperative care. For instance, I regularly assisted with cataract surgeries, from preparing the sterile field and instruments to ensuring patient comfort and administering postoperative eye drops. I became proficient in tasks like positioning patients, draping, and managing the phacoemulsification equipment. Beyond cataract procedures, I also supported procedures like LASIK and PRK, where I focused on maintaining a sterile environment and ensuring the laser equipment functioned correctly. I'm familiar with the specific needs of these procedures, such as managing the microkeratome or femtosecond laser. Furthermore, my experience includes assisting with procedures like vitrectomies and retinal detachments, which require a high level of precision and attention to detail. I became adept at anticipating the surgeon's needs and ensuring the availability of specialized instruments and supplies. I also assisted with less invasive procedures, such as administering injections for macular degeneration and assisting with laser treatments for glaucoma. Throughout my experience, I prioritized patient safety and comfort, ensuring they understood the procedure and felt supported throughout the process. I'm confident in my ability to adapt to new procedures and technologies as the field of ophthalmology advances.
Sterility and infection control are paramount in ophthalmic surgery. How do you ensure adherence to aseptic techniques in the operating theater environment?
Maintaining sterility and preventing infection is absolutely critical in ophthalmic surgery, and it's something I take incredibly seriously. My approach involves a multifaceted strategy that begins well before the surgery even starts. I'm meticulous about hand hygiene, adhering strictly to the 5 moments of hand washing as outlined by the WHO, and I ensure I'm properly gowned and gloved using sterile technique. In the operating theater, I play an active role in maintaining the sterile field. This includes verifying the sterility of all instruments and supplies, and immediately reporting any compromised packaging or questionable items to the surgical team. I'm very aware of critical zones and avoid any actions that could potentially contaminate the sterile field, such as reaching across it or passing non-sterile items into it. Beyond the immediate surgical field, I also pay close attention to the overall environment. I ensure that the room is properly cleaned and disinfected according to hospital protocols, and I'm vigilant about minimizing traffic in and out of the operating room during the procedure to reduce the risk of airborne contamination. I'm also familiar with the different sterilization methods used for ophthalmic instruments, such as autoclaving and gas sterilization, and I understand the importance of proper storage and handling of these sterile items. Finally, I believe communication is key. I work collaboratively with the entire surgical team to ensure everyone is on the same page regarding aseptic technique, and I'm not afraid to speak up if I see something that could potentially compromise sterility. I'm constantly learning and staying updated on the latest best practices in infection control to ensure the highest level of patient safety.
Ophthalmic instruments are delicate and specialized. How do you handle, maintain, and ensure the proper functioning of these instruments during a procedure?
Handling ophthalmic instruments requires a high degree of care and precision, and it's a responsibility I take very seriously. I understand that these instruments are not only delicate but also crucial for the success of the procedure. My approach involves a combination of careful handling, meticulous maintenance, and thorough inspection. Before any procedure, I meticulously inspect each instrument to ensure it's in perfect working order. This includes checking for any signs of damage, like dullness, nicks, or misalignment, and verifying that moving parts function smoothly. I'm familiar with the specific requirements of different instruments, from the fine tips of forceps to the precise calibration of lasers, and I know what to look for to ensure they're ready for use. During the procedure, I handle instruments with extreme care, avoiding any unnecessary force or contact with hard surfaces. I use proper techniques for passing instruments to the surgeon, ensuring they are positioned correctly and safely. I'm also aware of the specific handling requirements for different types of instruments, such as avoiding touching the tips of microsurgical instruments with anything other than designated materials. Post-operatively, I'm diligent about cleaning and reprocessing the instruments according to established protocols. This includes removing any debris or biological material and using appropriate cleaning solutions and techniques to avoid damaging delicate surfaces. I understand the importance of following the manufacturer's instructions for cleaning and sterilization to maintain the integrity of the instruments. I also participate in regular inventory checks and ensure that instruments are properly stored and organized to prevent damage. Beyond the practical aspects, I believe it's important to have a deep understanding of the function of each instrument. This knowledge helps me anticipate the surgeon's needs and ensures I can quickly and efficiently provide the correct instrument at the right time, contributing to a smooth and successful surgical flow. I'm also always open to learning about new instruments and techniques, and I actively seek opportunities to expand my knowledge in this area.
Communication is crucial in the operating theater. How do you communicate effectively with the surgical team, including surgeons, anesthesiologists, and other nurses, especially in high-pressure situations?
Effective communication in the operating theater is absolutely essential for patient safety and a smooth surgical flow. It's a dynamic environment where clear, concise, and timely communication is paramount, especially when things get hectic. My approach to communication in the OR is built on several key principles. First and foremost, I prioritize clarity and conciseness. In the OR, there's no room for ambiguity. I make sure my communication is direct, using precise medical terminology and avoiding any jargon that might be misunderstood. I also keep my messages brief and to the point, conveying the necessary information efficiently. Secondly, I believe in active listening. I pay close attention to what the surgeons, anesthesiologists, and other team members are saying, both verbally and non-verbally. I ask clarifying questions if needed to ensure I fully understand their instructions or concerns. This helps prevent misunderstandings and ensures everyone is on the same page. Thirdly, I understand the importance of closed-loop communication. This means that when I receive an instruction or piece of information, I acknowledge it and confirm my understanding. For example, if a surgeon asks for a specific instrument, I acknowledge the request, retrieve the instrument, and confirm that it's the correct one before handing it over. This helps prevent errors and ensures everyone is working in sync. In high-pressure situations, communication becomes even more critical. I remain calm and focused, and I use clear and assertive communication to convey any urgent information or concerns. I'm not afraid to speak up if I see something that could potentially compromise patient safety, even if it means questioning a senior team member. However, I always do so respectfully and professionally. Beyond verbal communication, I also pay attention to nonverbal cues. Body language, facial expressions, and tone of voice can all convey important information. I try to be aware of my own nonverbal communication and ensure it's aligned with my message. Finally, I believe in fostering a culture of open communication in the OR. I work to build rapport with my colleagues and create an environment where everyone feels comfortable sharing their thoughts and concerns. This includes being respectful and supportive of other team members and being open to feedback. Effective communication in the OR is an ongoing process, and I'm always striving to improve my skills in this area. I believe that by prioritizing clarity, active listening, closed-loop communication, and a culture of open communication, we can create a safer and more efficient operating theater environment for everyone.
Imagine a situation where a critical piece of equipment malfunctions during an ophthalmic procedure. How would you respond in this situation?
A malfunctioning piece of equipment during an ophthalmic procedure is a serious situation that demands a swift and decisive response. My priority in such a scenario would be the patient's safety and the smooth continuation of the procedure, if possible. My response would involve several key steps. First, I would immediately inform the surgeon and the anesthesiologist about the equipment malfunction. Clear and concise communication is crucial at this point. I would describe the specific nature of the malfunction, avoiding any technical jargon that might not be immediately understood by everyone in the room. For example, instead of saying, "The phacoemulsification machine is experiencing a software glitch," I might say, "The machine isn't responding to my commands for aspiration." Second, I would assess the immediate impact of the malfunction on the procedure. Is it something that can be quickly resolved, or does it necessitate a change in course? If it's a minor issue, like a loose connection or a software glitch that can be quickly reset, I would attempt to troubleshoot it following established protocols. However, I would never attempt to fix anything beyond my scope of expertise, and I certainly wouldn't delay informing the surgeon while I try to fix it if it's impacting the procedure. Third, if the malfunction is more serious and cannot be easily resolved, I would work with the surgical team to determine the best course of action. This might involve switching to a backup piece of equipment if one is available, or if the procedure allows, temporarily pausing the procedure while the issue is addressed by biomedical engineering. In some cases, it might be necessary to reschedule the procedure altogether. Throughout this process, I would remain calm and focused, and I would do my best to reassure the patient and keep them informed about what is happening. Fourth, I would document the malfunction thoroughly. This includes noting the specific nature of the problem, the time it occurred, the steps taken to address it, and the ultimate outcome. This documentation is essential for future troubleshooting and prevention. Finally, after the immediate situation is resolved, I would report the equipment malfunction to the appropriate personnel, such as biomedical engineering or the equipment manufacturer, so they can investigate the issue and prevent it from happening again. I believe in a proactive approach to safety, and I'm always looking for ways to identify and mitigate potential risks. I also understand that these situations can be stressful for everyone involved, so I would also check in with my colleagues to ensure they're okay and offer support if needed.
Many ophthalmic procedures involve the use of microscopes and other specialized equipment. Are you comfortable and proficient in using such equipment?
Yes, I am comfortable and proficient in using microscopes and other specialized equipment commonly used in ophthalmic procedures. Throughout my experience at City Hospital, I've had extensive hands-on experience with a variety of ophthalmic equipment. I'm very familiar with operating the surgical microscope, including adjusting the magnification, focus, and illumination to provide the surgeon with a clear and optimal view of the surgical field. I understand the importance of maintaining proper alignment and ensuring the microscope is functioning correctly throughout the procedure. Beyond the microscope, I'm also proficient in using other specialized equipment, such as phacoemulsification machines for cataract surgery, vitrectomy systems, and lasers used in procedures like LASIK, PRK, and treatments for glaucoma and retinal diseases. I recognize the specific functions and settings of each piece of equipment, and I'm trained in troubleshooting common issues that may arise. For example, with phacoemulsification machines, I'm familiar with adjusting parameters like aspiration flow rate, vacuum, and ultrasound power based on the surgeon's preferences and the specific stage of the procedure. Additionally, I know the importance of regular maintenance and calibration of these delicate instruments, and I work closely with biomedical engineering to ensure the equipment is always in optimal working condition. Furthermore, I'm a quick learner when it comes to new technologies. The field of ophthalmology is constantly evolving, and I'm committed to staying up to date with the latest advancements in equipment and techniques. I actively seek out opportunities to learn about new equipment, whether through training sessions, workshops, or online resources. I'm confident in my ability to adapt to new technologies and incorporate them into my practice to provide the best possible care for my patients.
How do you prepare the patient for an ophthalmic procedure, both physically and emotionally?
Preparing a patient for an ophthalmic procedure involves a holistic approach, addressing both their physical and emotional well-being. It's crucial to create a supportive and reassuring environment to minimize anxiety and ensure a positive experience. My approach starts with thorough communication. I take the time to explain the procedure in detail, using clear and simple language, and avoiding medical jargon as much as possible. I explain what the patient can expect before, during, and after the procedure, including any sensations they might experience. I encourage them to ask questions and address any concerns they might have. I find that visual aids, like diagrams or videos, can be very helpful in explaining the procedure and easing anxiety. Physically, I ensure the patient is comfortable and properly prepared. This might involve checking their vital signs, reviewing their medical history and medications, and confirming any allergies. I also prepare the surgical site according to established protocols, which might include cleaning the area and administering any necessary eye drops or medications. I double-check that the patient has followed any preoperative instructions, such as fasting or discontinuing certain medications. I also ensure they are properly positioned for the procedure and that any necessary equipment, like eye shields or supports, are in place. Emotionally, I strive to create a calm and reassuring atmosphere. I understand that many patients are anxious about eye procedures, so I approach them with empathy and understanding. I listen actively to their concerns and offer reassurance and support. I might use relaxation techniques, such as deep breathing exercises, to help calm their nerves. I also try to build rapport with the patient by engaging in friendly conversation and showing genuine interest in their well-being. I believe that a strong patient-nurse relationship built on trust and open communication can significantly reduce anxiety and improve the overall experience. I also make sure to explain the post-operative care instructions clearly and provide them with written materials to refer to at home. I encourage them to contact us with any questions or concerns they may have after the procedure. I believe that comprehensive patient education and support are essential components of successful ophthalmic care.
Describe your understanding of the different types of intraocular lenses, IOLs, and their uses in cataract surgery.
I have a solid understanding of the various types of intraocular lenses, IOLs, used in cataract surgery, and I appreciate the importance of selecting the right IOL for each individual patient. I know that IOLs are artificial lenses that replace the eye's natural lens after it's been clouded by a cataract. They play a crucial role in restoring vision after cataract surgery. I understand the basic categories of IOLs, starting with the traditional monofocal IOL. These lenses have a single focus, typically corrected for distance vision. While they provide excellent distance vision, patients may still need glasses for near and intermediate tasks. I'm also familiar with multifocal IOLs, which are designed to provide clear vision at multiple distances, distance, intermediate, and near. These lenses have different zones or rings that focus light at varying distances, reducing or eliminating the need for glasses. However, I also understand that multifocal IOLs can sometimes cause visual disturbances like halos or glare, which are important considerations in patient selection. Then there are accommodating IOLs. These lenses are designed to mimic the natural focusing ability of the eye by changing shape, allowing for better vision at all distances. While accommodating IOLs offer a wider range of vision than monofocal IOLs, their performance can vary. I'm also aware of toric IOLs, which are specifically designed to correct astigmatism, a common refractive error. Toric IOLs have a specific orientation that must be precisely placed during surgery to correct the astigmatism. Finally, I understand the role of extended depth of focus, EDOF, IOLs. These lenses provide an elongated focus, offering good distance and intermediate vision, and often functional near vision, though not necessarily the same level of near vision as a multifocal IOL. They can be a good option for patients who want a wider range of vision with a lower risk of visual disturbances compared to multifocal IOLs. Beyond the different types, I also understand the importance of factors like material composition, lens design, and diopter power in IOL selection. I know that the ophthalmologist works closely with the patient to determine the most appropriate IOL based on their individual needs, lifestyle, and eye health. I also understand my role in educating patients about the different IOL options and helping them understand the benefits and limitations of each type.
Ophthalmic surgery often involves very small incisions and delicate tissues. How do you maintain focus and precision during these procedures?
Maintaining focus and precision during ophthalmic procedures, which often involve delicate tissues and microscopic manipulation, is absolutely paramount. It's a skill that requires a combination of training, practice, and a specific mindset. For me, it starts with thorough preparation. Before any procedure, I ensure I'm completely familiar with the surgical plan, the patient's specific needs, and the instruments and equipment that will be used. This mental preparation helps me anticipate the steps of the procedure and allows me to focus my attention on the task at hand. During the procedure itself, I prioritize minimizing distractions. This includes ensuring the operating room environment is calm and quiet, and that all necessary materials are readily available. I also consciously practice mindfulness, focusing my attention on the immediate task and avoiding any mental wandering. I understand that even small distractions can lead to errors in such delicate procedures. Precision is key in ophthalmic surgery. I pay close attention to detail, whether it's handling instruments, positioning tissues, or administering medications. I use fine motor skills and gentle movements to avoid causing any unnecessary trauma to the delicate ocular structures. I'm also aware of the importance of proper ergonomics. Maintaining a comfortable and stable posture helps prevent fatigue and allows me to maintain precision throughout the procedure. I'm also very aware of the surgeon's movements and anticipate their needs, ensuring a smooth and efficient flow of the procedure. Beyond the physical aspects, I believe mental focus is equally important. I maintain a calm and focused demeanor, even in stressful situations. I avoid rushing and take my time to ensure each step is performed correctly. If I ever feel my focus wavering, I take a brief moment to refocus and recenter myself. I also understand the importance of communication. Clear and concise communication with the surgical team helps prevent misunderstandings and ensures everyone is on the same page. Finally, I recognize that maintaining focus and precision is an ongoing process. I continuously seek opportunities to improve my skills, whether it's through attending workshops, observing experienced surgeons, or practicing with simulation tools. I also reflect on each procedure, identifying areas where I can improve my focus and precision in the future. It's a constant process of learning and refinement, and I'm committed to providing the highest level of care for my patients.
Continuing education is essential in the ever-evolving field of ophthalmology. How do you stay updated on the latest advancements in ophthalmic procedures, techniques, and technologies?
Continuing education is absolutely vital in ophthalmology, a field that's constantly evolving with new procedures, techniques, and technologies emerging regularly. I'm committed to staying at the forefront of these advancements, and I employ a multifaceted approach to ensure I'm always up to date. I regularly attend professional conferences and workshops, both locally and internationally, whenever possible. These events provide invaluable opportunities to learn from leading experts in the field, hear about the latest research findings, and see demonstrations of new technologies. I find these conferences incredibly stimulating, and they often spark new ideas and approaches that I can bring back to my practice. Beyond conferences, I actively engage in online learning. I subscribe to several reputable ophthalmology journals and online resources, such as the American Academy of Ophthalmology's website, and I regularly read articles and watch webinars on the latest advancements. I'm particularly interested in staying informed about new surgical techniques, advancements in diagnostic imaging, and the development of new medications and treatments. I also find online forums and communities of ophthalmology professionals to be very helpful. These platforms allow me to connect with colleagues from around the world, share experiences, and discuss challenging cases. It's a great way to learn from others and get different perspectives on various clinical issues. Furthermore, I believe in continuous self-assessment. I regularly review my own practice and identify areas where I can improve my knowledge or skills. I also seek feedback from my colleagues and supervisors, which helps me identify areas where I can focus my learning efforts. I'm also fortunate to work in an environment that encourages continuing education. My hospital provides access to online learning platforms and supports my attendance at conferences and workshops. I believe that a combination of these strategies, attending conferences, engaging in online learning, participating in professional communities, and self-assessing my practice, is essential for staying current in the ever-evolving field of ophthalmology and ensuring I can provide the best possible care for my patients.